We are now connected with Dr. Tribowo Tuahta Ginting, a psychiatrist from the MMC Hospital in Jakarta, and Novabella, Massie, influence director at the Kopi Panas Foundation, which is a non-profit organization focusing on humanitarian issues, including mental health. Thank you for joining us.
Thank you. It's my
Doc-
pleasure.
Thank you. It's my pleasure.
All right. So first of all, I want to ask Dr. Tribo, could you briefly explain the differences between mental disorder and mental illness?
Okay, thank you, Yarsa. Mental illness and mental disorder used as general term for all the condition which involve abnormalities in the brain and resulting in changes in feeling, emotion, personality, and behavior. And what is different? The difference is mental illness is defined as a pathological condition of the brain characterized by a set of identifiable symptoms and signs and occur as a result of various etiological conditions like infection, genetic, and so on. So mental illness occur as a result of an abnormal or disturbance chemical in the brain like neurotransmitter. But mental disorder is a condition as a changes that occur in an individual thought patterns and emotion that interfere with daily activities, especially because of disorder that occur in the brain. So mental disorder occur due to an abnormalities in the normal functioning of the brain. To be known as disorder when it starts impending one daily activities and any condition which involve a disturbed brain. So disorder must meet with the criteria of mental disorder in DSM or ICD, and for Indonesian version is PPDGJ, Pedoman Penata Laksanaan Diagnosis Gangguan Jiwa. That is.
Okay, so is mental illness exclusively hereditary or independent on genetic makeup, or can it also develop due to pandemic? I mean, there's people go through a lot of hardship during the pandemic, and the way people behave, the way people function on a daily basis also change. Can you explain more of this?
Yeah, genetic can cause changes in neurotransmitters. It can be called a mental illness. If a pandemic situation or other situation can cause an imbalance or changes in neurotransmitter, it can lead to mental illness. We saw in the previous definition that mental illness occurs as a result of abnormal or disturbed chemicals in the brain, such as neurotransmitter. So any situation that can cause changes in a neurotransmitter can be called a mental illness. So pandemic situation, stress situation, or any problem that happen in normal life can cause stress and changes in a neurotransmitter, so can be called a mental illness.
I see. Now, I would like to move on to Novabella. Why does the Kopi Panas Foundation help those with mental disorders?
Kopi Panas Foundation is a organization focusing on human issues and was initiated and founded by Prisia Nasution in 2018. And we had great dreams to create a harmonious life among people, as well as maintaining a sustainable balance of nature. And in the early stage of growth, Kopi Panas Foundation is focusing their efforts to help people with mental disorder through increasing the build the capacity of our shelter partners in Indonesia and to increase public awareness about mental health.
Okay, so what are the specific programs available for those with mental illness? You're talking about shelters. What's happening here? What's actually going on in the larger spectrum right here? Maybe in Jakarta, the greater Jakarta area.
Yeah, honestly saying that there are still very low awareness regarding people with mental healthness in our surrounding, and right now we have about 12 programs that we're trying to run as a campaign, and everything is still involving about people with mental disorder, and some of them is about doing some activities such as basketball. We call the program as sports charity program. And we also have a program called Happy Sharing. Is about routine that we do monthly to break the stigma, the negative stigma about people with mental disorder by doing a direct interaction with them in the shelters. And then we also have one of our programs is called Rumah. It's the program to build and to help renovate all the shelters that right now is not in really, really good condition, not as in, like a normal, like most people live in every day. And we want them to have a decent life. And then that's why we call them Rumah, because we want to put hope on it. And we have several programs, but basically right now we are trying to engage the community with people with mental disorders.
Okay, before we go into a break, I would like to ask, how many shelters are you working with at the moment, and what is the population of average population of each shelter, and how many total are you working with?
By far, we have about 8 partner shelters spread it in. Right now, we have in Jakarta, and by far we have in Tasikmalaya and Cianjur. And the population of them is very variative because it depends on the capacity of the shelter itself. Some of them contains about 20 or 30 people. Some of them contains around 400 people. So it's basically variative depending on the size of the shelter itself.
Okay, in terms of the activities, how are you organizing the programs there? I mean, one of the things, the activities that you do is you do with sports. I mean, playing basketball. Do you have to identify how many? Maybe for one particular shelter, they would be interested in basketball, or is there any particular sport that you prefer that probably would encourage them to work together as a team, or are you doing more of an individual type sports?
Honestly saying, because I'm a former basketball player in Indonesia, and my intentions to create the engagement with people with mental disorder is by doing sports and as in groups, because we wanted them to engage with people. We want them to build a situation where they can work together. In this case, are playing basketball. And also, this is like the second event that we held this year for our sports charity program, and we want to expand to other sports. Our plan is to have a so-called mini soccer sports charity program. So basically, we're trying to engage people with mental disorder by doing sort of activities in groups, so they can engage together and to build a communication that they probably rarely get it in the shelter.
I see. Again, you're working with about 8 shelters right now.
Yeah.
How does one get connected with Kopi Panas Foundation? Do family members contact you and try to get a family, maybe like a family member or a friend, to be involved in the programs, or do you work exclusively, more exclusively with the shelters?
Honestly, we're doing surveys to engage partnership with the shelters, because most of the shelters are like a little bit abandoned by the government, because they don't have any decent things to do, or even to have as in daily activity, the way they sleep, the way they do their activities. It's far from what we call a decent life. So that's why we choose them. We kind of do a survey, and we choose which one that we should put in our help or distribute all the donation that we can do for them.
I see. And when you were talking about shelters, these are government funded shelters, correct? But under the Social Affairs Minister, is that what it is?
No, it's actually a private shelters.
They're private shelters, okay.
Correct.
And they're all private shelters?
Most of them are, yes, private shelters by far.
Okay. All right. Let's go back to Dr. Tribowo. In terms of the mental illness, I mean, we're talking. Let's go back to mental illness, mental disorder. We're talking. Let's rewind. 40 years back. 50 years back, when there's not medication that is created to help with mental conditions. I'm sure you're very familiar with practice such as lobotomy. Like lobotomy used to be the cure for different kinds of incurable, mysterious diseases. Um, and is what are the what- is there a- what are the most common available medication out there, and what does the medication actually do for to overcome some perhaps symptoms that for people with mental disorder? I
Yeah,
mean, understanding that it's not trying to fix them, but trying to problem manage um, some unwanted, I guess, behaviors, so they can interact better with others.
yeah. Medication depends on the disorder or the disease. Uh, we have many types of mental illness or mental disorder, like schizophrenia, anxiety disorder, depression, and so on. So the medication depends on that diagnosis. If they get depression, we will give them medication such as antidepressant or combined with anti-anxiety. If there has schizophrenia, they will get like antipsychotic to cure them. But in the past, as you said before, that lobotomy is used to be one of the treatment to reduce the aggression and the aggression and the rage of the people with mental disorder or schizophrenia. So um,
Hmm.
today we don't do the things like that, like lobotomy, but we use medication to help them to cure the disease and to help them maintain their healthy,
Hmm.
and combined with other non-medical treatments such as
Hmm.
psychotherapy, counseling, and so on.
I see. Dr. Tribo and Novabella, Doc, I think you know what you just mentioned about some medications containing chemicals. So because earlier during the talk you were speaking about chemical imbalances, right? And Novabella is a sports enthusiast, sports person. So let's talk about what chemicals are produced when people are doing sports. How's that? Let's talk
Cool.
about that
Sounds
in the
great.
next segment. All right, so we'll continue our chat with Dr. Thibault and Novabella after break. So stay tuned to the Daily Wrap Up.